Hello everyone, this is Dr. Rudra Mohan, your friendly neighborhood dentist, and through this oral health channel, let's talk about burning sensation in the mouth. Let's start. So today we're going to be talking about burning sensation in the mouth, a very common problem that is seen almost with everyone at some point of time in their lives. Now what we need to understand is that burning problem or burning sensation in the mouth is something that you should not ignore if it persists for a long time. It could be very minimally possible that it just might be a reaction to something that you ate, such as the condiments in the food that we eat, or at the same time it could just be a reaction, an allergic reaction to whatever you have consumed, including a change of toothpaste that you must have used and changed over a period of time. Now, if this problem really persists, then you definitely have to go to the dentist and get yourself checked out. Along with this, if you feel that there are some other symptoms or signs that you can see in your mouth, some findings such as red or white lesions, definitely you should consider going to the dentist and getting yourself checked. Also, there are a lot of risk factors that are involved in such kind of a problem, such as smoking, tobacco abuse, and alcohol abuse. At the same time, if you are a very stressed out person, you are more likely to have a burning mouth sensation in the mouth due to stress related activity. Now, there are also other risk factors involved, such as vitamin B complex deficiency and vitamin D deficiency. So you might want to get yourself checked out before that. If you can get a blood workup done, that would be more than enough. However, if you feel the need to go to a dentist and get yourself checked out, it is the best option. Now, what are the causes of a burning mouth? You can probably, it might be just because of dry mouth. That also happens because a dry mouth leads to rendering your skin of the mouth or the oral mucosa susceptible to ulcerations. At the same time, it is not very good quality, or I should say it is susceptible to irritation. At the same time, if you're a diabetic patient, you will definitely have a dry mouth, and at the same time you can have something known as opportunistic infections. Opportunistic infections means that they will affect your body when your immunity is low. Now, in diabetes, your body definitely undergoes a transformation where you become immunocompromised, and definitely you are more susceptible to infections, and the delaying of wound healing takes place. That means that your tissues cannot heal the way they used to when your sugar levels were normal. Now, if that is the case, you might come across something known as oral thrush or oral candidiasis, which is caused by a fungus, and it is an opportunistic infection which definitely causes scrapable lesions or white thrush in the mouth, and it leaves a raw eroded surface which causes burning sensation. The other common cause in ladies for burning mouth is age, where during their perimenopausal phase they can develop something known as burning mouth syndrome, that is due to the decline of the so-called hormones that are produced, which help in keeping the tissue barrier intact and keeping the tissues healthy. Also, if you're anemic, you're most likely to suffer from burning mouth, because it has been found that if you have low hemoglobin, your tissues are more susceptible to irritation and they can give you complaints such as burning mouth. Now, there are some disease processes or conditions or lesions in the mouth that can also cause burning sensation, such as lichen planus, pemphigus, and other lesions. Now, if that is the case, it will be accompanied by some other signs, such as some sort of red and white lesions in the mouth, maybe some dermatological manifestations, skin rashes, or spots. In case you see that there is something else apart from the burning sensation of the mouth, and the burning sensation of the mouth has been increasing gradually, where you're not even able to tolerate the food that is normally enjoyed by other people and it was tolerated by you at some point of time, you should definitely go to a dentist and get some tests done. If you're a malnourished person, that means you're not eating properly, you're probably not sleeping well, you're eating in an erratic pattern, at the same time you don't have a balanced diet, there's a high likely chance that you are suffering from some sort of a vitamin deficiency, and you should therefore focus on making sure that you eat a regular diet. Try to go for stress reduction. I understand that stress can sometimes be overwhelming, but please remember that stress is the biggest killer on the planet for us, and it is very important that you need to calm your stress down, make sure that you are more coping well with it. A lot of times stress is not coped up well with the help of either smoking or tobacco consumption or alcohol abuse. So please make sure that you meet the required people and the personnel for counseling, and make sure that you are taken care of. To conclude, if you feel the need to see a dentist for a burning mouth sensation, you should definitely go to one, because if the problem is not resolving on its own, if you're feeling that there is a lot of other problems that are happening together and the propensity and the intensity of this sensation is increasing, which is causing so much discomfort that you cannot go about the day, then you should definitely see a doctor regarding this, and they will probably do some tests, ask some questions, and probably get some lab work done for you till we arrive at a diagnosis. And it is always better to listen to your dentist for whatever advice that they give for the problems that you have. So with this, please write your comments in the comment section, and please like, share and subscribe, and spread the word about oral health awareness and help us grow. Thank you.